Thank you for joining our webinar. We appreciate your interest in learning how health plans, pharmacy benefit managers, and others are unleashing the power of therapeutic interchange to improve medication adherence. Today, we'll look at how therapeutic interchange offers options to high-cost prescriptions, increases member satisfaction and retention, and ultimately improves health plan performance and star ratings. We'll examine real-world use cases and demonstrate how you can be more proactive with member outreach to encourage members to connect with their prescribers about medication alternatives beyond the generics we are probably more likely all to be familiar with. I'm Cara Tarantino, Director of Marketing with ConnectRx, and I'm presenting today with Amanda Woodman, Sales Executive for our Health Plan Market segment. We'll follow up after the webinar with any questions you may have. Send a recording of the webinar. We hope you'll send these questions along with any feedback to marketing@connectr.com. And now I'll pass things over to Amanda to get us started.
Thank you, Cara. So just a few words about ConnectRx. We've been around since 2000, and if you're familiar with us, you might know us better as DestinationRx. In 2013, DestinationRx was acquired by ConnectR to add Medicare and drug transparency to the overall product suite. And so today we go by ConnectRx. As a software company, we provide both hosted and API SaaS solutions to health plans, multi-carrier organizations, agencies, and pharmacy benefit managers, all with the goal of pairing beneficiaries with their best fit Medicare plans. Our expertise in drug pricing has afforded us the opportunity to offer DatabaseRX, our therapeutic interchange database and analytics solution, and Drug Compare, our consumer self-service drug comparison technology and analytics that offers lower cost drug options proven to increase medication adherence and elevate star ratings. Via all of our products, we serve over 20 million consumers annually with our enrollment and drug comparison technologies. And we have the largest distribution network in the industry, offering an easy way to connect health plan products to agents and agents to the products they sell. We have a long history of expertise in Medicare Part D pricing space and currently provide drug pricing services to 94% of the Medicare Part D market. This extensive experience in drug pricing gives us a leg up in understanding how health plans need to respond in the market today. So we say our pricing is the gold standard in the Medicare industry because it is the most accurate anywhere. And there are several reasons for this. First, we gather the most volume of data directly from carriers, utilizing the same data they send to CMS for the Medicare.gov cost calculations. And second, our tools can price drugs down to the local pharmacy level. Our cost calculations include many considerations, including partial gaps, donut hole, preferred status, subsidy, and discount variances. And lastly, we update our drug pricing data every 2 weeks. This information sets the stage for what is going on in the world today with the extraordinary cost of prescription medications and the ability for health plans to find the most effective, lower cost options for members. When members keep money in their own pockets, this helps lower overall healthcare costs as well as improve outcomes. We know that if health plans can assist members in this way, members will have higher levels of customer satisfaction, which in turn will prevent plan switching and improve member loyalty. So today we're going to show you how our therapeutic interchange solution, we call DatabaseRX, a powerful solution because it tackles real-world healthcare problems, we will be addressing today. As the name implies, DatabaseRx is a database of medication alternatives with impactful analytics with the ability to get far beyond generic medications. So we want your members to do more than just switch from a brand drug to generic, be a solution when faced with drug shortages and recalls, offer lower cost medication options, provide price transparency to prescribers and pharmacists and put members more directly in control of their own health, and help members improve medication adherence, which can ultimately improve health plan star ratings. Each of these areas has the power to better connect health plans to members, elevating electronic engagement, increasing member satisfaction, and ultimately being trust and brand loyalty. For those of you not familiar with therapeutic interchange, here's a little bit of background information. Therapeutic interchange is defined according to the Academy of Managed Care Pharmacy as the practice of replacing with the prescribing physician's approval a prescription medication originally prescribed for a patient with a chemically different medication. In other words, it's when you take one drug and replace it with another drug that is comparable in its effectiveness. Therapeutic interchange can be incorporated into a member or prescriber-facing tool, an analytics engine, or a drug database. It can also be used at multiple points throughout the life cycle of a prescription to identify cost-saving strategies for health plans and members through the use of the lower-cost drug options. It goes beyond replacing high-cost prescription medications with generic equivalents and can incorporate other comparable brand, generic, and over-the-counter medications. All therapeutic interchange programs should be evidence-based. They should be based on clinical effectiveness research and other medical literature. And there's usually more than one drug available to treat a particular condition. Clinical evidence can demonstrate which drugs can be interchanged for each other and under what circumstances this interchange would be appropriate. Because of this, extensive and ongoing research is not only necessary, it's vital. At ConnectRx, we have one of the most comprehensive therapeutic interchange databases that health plans and PBMs have relied upon for over 20 years. DatabaseRX was created using all of these diverse sources you see on the slides, including clinical studies, practice guidelines, as well as drug information sites and manufacturers' prescribing information. And we also look at product recalls and the reasons behind them, whether they originate from the manufacturer or from the FDA. And we also use data from multiple drug data warehouses like Metaspan and FDB. Currently, ConnectRx's therapeutic interchange database holds over 140 drug classes with over 42,000 active NDCs. So this slide illustrates the evidence-based research that is involved, and I'm going to show you why it is so valuable. All therapeutic classes are created and maintained by pharmacists. Our pharmacists review literature to identify which drugs and in what doses can be interchanged for different conditions. Then board-certified physicians, who are all practicing in their respective settings, review what has been created to ensure it is consistent with current practice trends and what they see with their patients. After physician review, drug classes go through a database integration process, and this is where the clinical research is merged with drug data elements such as the NDC and package sizes to include in the database. Maintenance is the final step and is actually the most arduous step in the process. We have to ensure that all of the therapeutic interchange drug classes are up to date with new drug approvals and discontinuations, as well as new practice guidelines, clinical studies, and safety notices. So here we'll take a look at the different types of therapeutic interchange options. The first are direct generics. So direct generic is identical to the original brand drug, so it does not require a new prescription to make a switch. For example, Lipitor and atorvastatin have the same chemical composition, so pharmacists can switch a member from the brand to the generic without consulting with a prescriber. Second are the generic drug alternatives. These are lower cost medications that are generics but cannot be switched automatically. The prescriber must write a new prescription to authorize the switch. And then third, we have preferred brands, which is a comparable brand drug and not a generic. These also require a new prescription from the physician. And then finally, we have over-the-counter medications. Members can go from a prescribed drug to an OTC comparable option, removing the need for a new prescription. Often, members or prescribers are unaware that an OTC is actually available. So this is typically a more cost-effective option. Contrary to what you may think, switching to direct generic does not always offer the best savings potential. To demonstrate, we looked at the formulary reference file, which is a file created and maintained by CMS that contains a list of drugs that may be included in Part D formularies. This list contains approximately 6,000 drugs. Out of more than 6,200 drugs, there are roughly 3,300 brands. Per the graph, of those 3,200 brand drugs, 62% had a therapeutic interchange option. This compares to only 40%, which had a direct generic option. So that's over 700 additional doses in our DatabaseRX database, presenting a wealth of opportunity to go beyond generics. To further illustrate this point, let's look at two examples where the direct generic is not the cheapest option available. So here we have averaged out the cost per unit for different brand and generic drugs that health plans typically pay for medications, a portion of which is then passed on to their members as copays or coinsurance. So the average Medicare cost of an EpiPen is $310 per unit. Its direct generic, epinephrine, is $161, which is a 20% savings. However, there's also a brand alternative called Symjepi at $133, and that's a savings of over 57% off the brand. And then for another example, let's look at the ADHD drug Concerta, which retails at $390 per month for 30 tablets. And the generic is a $179 for a comparable dosage, which is a savings of over 54%. Sounds great, but there's also a therapeutic interchange option of generic Adderall requiring 60 tablets a month, but costs only $38 per month at this quantity. That's a savings of over 90% off of the original brand Concerta. These examples show how important visibility into therapeutic interchange options can be for health plans and their members. Switching from Concerta to generic Adderall offers a savings of $350 per month. So in total, when looking at over 6,200 medications on the CMS formulary reference file, we determined that roughly half had potential lower cost alternatives in the market. And in just a bit, we'll look at a case study of the magnitude of potential savings. But first, I'm going to turn it over to Kara to discuss our next real world scenario.
Thank you, Amanda. Here we'll show an example of how therapeutic interchange can be used when there are drug shortages and recalls. Last year, the FDA announced an immediate market withdrawal of Zantac due to reported carcinogen contamination. This was following months of voluntary recalls after trace amounts of the carcinogen were first reported in 2019. The recall affected millions of individuals who were taking the OTC drug, along with 15 million people on prescription strength Zantac. With access to our Drug Compare and DatabaseRX tools, health plans and members were able to log online from any device and look for other options for Zantac. This allowed members armed with new information to take the initiative to talk to their prescribers about alternatives. Some of these therapeutic interchange options include Tagamet, Pepcid, and Axit. Interestingly, the Zantac shortage has led people to taking more Pepcid or its generic famotidine. As a result, this was then added to the drug list, drug shortages by the FDA, the generic was. So in the world of therapeutic interchange, it's important to stay current to support the needs of patients, prescribers, pharmacies, and health plans. As a result of COVID-19, drug shortages remain top of mind these days. It's creating a paradigm shift, helping pharmacists to become more resilient than ever. Pharmacists can send requests to prescribers and let them know a medication is out of stock and initiate a change for a different therapeutic option. And now new laws in certain states allow pharmacists to dispense drug options without requiring a new prescription. DatabaseRX empowers pharmacists to navigate the members' formulary along with drug pricing information to help them be more proactive in finding new drug options at any time. So our next real-world situation focuses on high prescription costs and how to lower them. COVID-19 has also dramatically changed healthcare delivery, and the economic impact of the virus on healthcare spending is still not fully known. According to AARP, brand name prescription drugs continue to increase twice as much as inflation, making many life-saving medicines potentially unaffordable for seniors. According to a recent report, a senior who takes 4 to 5 prescription drugs per month would pay about $31,000 per year. The graph to the right shows the average price for the top 10 brand name drugs over the past dozen years or so, as compared to the overall inflation rate according to the Bureau of Labor Statistics. And according to a Truven Health Analytics NPR Health poll, 67% of patients do not take their medications because they cannot afford them. Due to the economic impact of the pandemic, we know that medication adherence is becoming more and more of an issue as people cannot afford their medications. This means lower cost therapeutic interchange options are more important than ever. So now let's look at the potential magnitude of savings we are talking about with DatabaseRX. We ran an opportunity analysis on over 8.7 million prescriptions for the CMS Formulary reference file drugs. We put this claims data through our analytics engine and evaluated the estimated cost and potential savings amounts by therapeutic class. The potential savings here are available to health plans as members switch from higher cost to lower cost drugs. The 8.7 million prescriptions added about $1.2 billion in overall spending. Of these, roughly 32% had lower cost options in our database. If all these prescriptions were switched to the lowest cost options, the savings would be 37% of the original spend, a savings of about $219 million. So you can imagine if even a fraction of these beneficiaries can be changed to lower cost drug options, the savings potential is significant. So this slide has a lot of info on it, but I wanted to call attention to the fact that 2/3 of the potential savings we're looking at comes from just 10 disease categories. And you can see what those categories are here. So let's first take a look at diabetes. As we know, diabetes is a big problem in this country. Over 34 million people in the US suffer from diabetes, yet insulin prices have tripled in the past 10 years. Novolog is $30 per unit. A comparable brand is Admelog, which averages $13 per unit. So if a health plan can get all their members to switch, they would see a savings of about $9.3 million per year. So now let's look at rheumatoid arthritis. Rheumatoid arthritis requires consistent aggressive treatment to control symptoms, manage pain, and stop disease progression. RA is estimated to cost $19 billion a year in the US, with many patients paying up to $30,000 annually for their medication costs alone. Those with insurance can still end up paying 30% or more of the total cost of certain medications. So if we look at specific drugs in the RA category, we can see the following. Humira was prescribed in our claims study at an average cost of $2,600 per unit. When comparing Humira to other drugs, we find that Cimzia costs $4,400 per unit, but it requires half the dosing of Humira. So this means that switching from Humira to Cimzia resulted in a savings of over $8.4 million. And this was for the 21,000 units that were in our use case study. So this example demonstrates the importance in having an accurate dose-to-dose ratio in determining cost savings. So finally, let's look at the types of medication switches that were the most common and beneficial. Switching members from a brand to a generic or from a brand to a lower cost brand gave us the greatest savings potential, more than 70 million for each category. Going from generic to another generic has 48 million in potential savings, largely due to the high volume of units prescribed for these lower cost drugs. There were only a few instances where the direct generic was the lowest cost alternative, and those accounted for roughly 17 million in potential savings. Of course, individual results will vary based on a health plan's own negotiated pricing and preferred drug list. The overall price process and the magnitude of potential savings demonstrated here should remain consistent. Let's look now at how price transparency can help us realize our savings potential. People generally don't pick the lowest cost drugs simply because they don't know what their options are. Let's take a look at some potential points of interaction where DatabaseRX can make a difference. The doctor's office is the ideal place to introduce price transparency and get members on the right prescription from the start. Being able to see the estimated cost for the prescribed medication on the electronic health record, along with the list of potential options, would be hugely beneficial for physicians. This would save time in reducing costly callbacks and help improve their patients' adherence to the prescribed regimen. Also, having a standalone site is another way to bridge the price transparency gap and get physicians the information they need from a reliable source. ConnectRx's Drug Compare is an example of such a source providing cost transparency and therapeutic interchange data to a multitude of users. On this slide, you can see a screenshot of one instance of the Drug Compare tool. This technology can be used as a hosted site or made available via API. It's a great way for prescribers and members to confirm that the prescriptions they are starting on are the right fit medications for their plan. Pharmacists are next in the prescription chain. Pharmacists can be a bridge between the member and the physician. They're usually the first to know when a member is trying to purchase a drug that is high cost or off formulary. So I ask you, how do we get the therapeutic interchange data into pharmacies? Many PBMs today accept preferred alternative drug lists from health plans. These are high-cost target drugs, and their preferred alternatives are specific to the carrier's formulary designs. The pharmacist system can return the list of alternatives and can then take this information to the prescriber to get a prescription change before the patient even starts on their medication. So with DatabaseRX, we take into account prior authorization restrictions to reduce unnecessary overhead, fewer calls and faxes. We can quickly deliver to the health plans thousands of lower cost options tailored to specific formularies. In-pharmacy messaging is an excellent option for health plans looking to provide options for their members struggling with the sticker shock of high-cost medications. Data security and HIPAA compliance rules can be barriers to communication, and it's important that health plans have visibility into their membership's drug utilization and therapeutic interchange opportunities. So we run our analysis from de-identified claims data, so no personal health information is exchanged. The analytics includes the same formulary and pricing information carriers already submit to CMS for Part D, or in many cases, this info is already submitted to ConnectRx for our health plan shopping tools. The end result? A detailed report with medications the health plan can target to realize the greatest savings on their investment. An important outreach component is direct-to-member messaging. Armed with this data, health plans can extend outreach programs to members on high-cost medications. They can communicate via email, text message, phone, or direct mail to inform members how they can reduce the cost of their prescriptions. These direct-to-member communications should encourage members to speak to their physicians about the alternatives or direct members to do their own research on Drug Compare, which can be housed on the health plan website. So even if a small portion of the targeted members make the switch, the savings can be substantial. This can also be a key differentiator in medication adherence and the relationship between members and their health plan. So now I'm going to pass things back to Amanda, who's going to wrap things up in the next couple of slides.
Thank you, Kara. We've set the foundation and given you use cases so you can see how therapeutic interchange offers medication options with the power to significantly reduce costs and improve adherence to prescribed treatment regimens. The cost of medications has been shown to be one of the biggest barriers to adherence, if not the biggest. As studies have concluded time and again, when drugs cost less, members are more apt to follow their prescribed treatments, which leads to better health outcomes. According to a 2019 Kaiser Family Foundation report, many seniors said they have difficulties affording their medications and taking them as prescribed. Nearly 80% of those surveyed said their condition worsened due to not taking their meds. As well, And as we all know, unfilled prescriptions can also lead to an increased risk of patients going to the ER, along with a chance of costly hospital readmissions. The importance of medication adherence is even reflected in CMS's star ratings. Out of the maximum 47 measures, 18 of them were related to medication management and adherence. So more than 50% of star rating measures relate to medication adherence. When the ultimate goal is member retention and improved plan performance and higher star ratings, health plans need the right digital tools, therapeutic alternative database, and analytics to connect with members to make it happen. A few key things to remember when elevating medication adherence is to use the right tools, DatabaseRX for health plans and drug compare for members on the health plan and PBM websites. Use data and analytics provided by DatabaseRX to target the right members who are on high-cost medications. Use member and health plan data to communicate to members via text, email, direct mail, and phone to let them know about specific lower-cost alternatives. And these may also be options that come with less frequent dosing schedules. And encourage them to reach out to their prescribers and make the change. And then lastly, add an additional benefit. An additional benefit is that when it comes time for CAP surveys, members will remember it was their health plan who saved them money. This will discourage dis-enrollments. Thank you all for joining us today. If you have any questions, please send them to marketing@connectr.com. We certainly appreciate your interest in ConnectRx and look forward to seeing you on future webinars.